A rat must be provided fresh water at all times. For feeding, we give them a commercial rodent chow, and it varies between species, but it's an average of 5 grams per 100 grams of body weight. We use the cage cards that we put on the cage, and it has the patient's name and species, how old, and that it's a female. And this is when it has come in to the hospital for boarding, and the customer did leave a pet carrier as well. So then we know to find that when the patient is being checked out. For enrichment for rats, it's very important to have a flat bottom cage, solid bottom cage with wiring so they can climb. They love to go into hidey houses and tubes as well, and hide in hay. They also enjoy playing with toys. You can take a toilet paper roll and fill it with hay and fold it down, or other food where they can go in and forage. Exercise is very important, and if they don't have another companion, it's important to socialize with them as well. It's very good for enrichment. For nutrition, the commercial rodent chow is adequate, but they also can have small amounts of fruits, vegetables, and seeds. With handling, you must wear a latex glove, because there's a possibility of transmitting leptospira disease. So you must always have latex gloves when handling a rat. In general, they are friendly, but you can occasionally have an aggressive rat. If you do have an aggressive rat, then you must use leather gloves to handle. Some common diseases that we see with rats is we often have the rats in for trauma because of fighting. There'll be bites and there'll be scratches on their body, and those areas can become lesions and become infected. So those would be the clinical signs. You would actually see the bites and scratches and then possible infection. Another common disease is malocclusion, because rats are hyposodontic, so their teeth are constantly growing. So they can overgrow, and you will see overgrown incisors. And it could be from too much of a soft food diet or not having enough stuff to gnaw their teeth down. So those will be the clinical signs that you see. Also, there could be weight loss as well, because they're unable to eat with their teeth overgrown. 80% of rats over the age of 2 have neoplasia. There'll be tumors that they'll find. They'll either be soft and movable, or they could be very firm. And clinical signs is some of the tumors make them unable to move around, and then also they can get an increased appetite, but then not gain weight, or they will lose weight and feel lethargic and have that loss of appetite. We also sometimes see lice, mites, and fleas. There'll be an inflammation of the skin, where you'll actually see the parasites on the body. With that as well, they'll feel a constant need to scratch. Another very common thing we see is respiratory disease. They'll be sneezing and sniffling, they'll have rales, and they'll have trouble breathing. Those are the clinical signs for that. There's also Pasteurella, which is very similar to There's also pasteurellosis, which is very similar to respiratory disease. It'll have the same clinical signs, but they also can develop abscesses with the Pasteurella. The abscesses can occur in the skin, the lymph nodes, the uterus, and the urinary tract. For anesthesia, there's no reason to withhold food because they do not vomit. They should have food up to an hour or 2 before the anesthesia, and then have food as soon as they recover. Because if they are withheld food too long, they can develop hypoglycemia. To induce anesthesia, it's less painful to use an IP induction. For your induction, the gas chambers with isoflurane are also the safest. You fill up from the bottom with the gas. With recovery, it's critical to establish a feeding pattern again, because once again, they've got to keep their blood sugar up. And also in recovery, they need to have a warm, quiet environment with shredded paper to hide will make them feel more secure. And if you do give them water, be careful that they don't spill the water, because if they get wet, then they can get too cold. So we recognize here that we have a rodent. The tail in rodents is actually longer than their body. It has the pointy nose, bulging eyes, He has only 4 digits on the forelimbs, but then they have 5 digits on the hind limbs. And they're smaller than that of a rabbit. They also only have 1 set of incisors. Never pick up a rat by grabbing the middle of the tail or the tip of the tail. You can cause a degloving injury. If you did pick them up, it would be more down this way, but there's still a tendency for them to twist around. They're a little better than mice to twist around and get you. If you have a docile rat, you can pick them up by scooping them like this. You gotta approach a rat calm and confident. You never approach them by grabbing towards the head because they'll see that as a threat. Another way to hold them is put your thumb and your index finger around their mandible, and then your middle finger under their armpits. That's one of the ways to restrain them. You can also grab them by their scruff. This is what you would do for the sub-Q shot. For oral medications, you're going to stretch out, you're going to hold them close to your body and stretch out their head and neck, and then administer the oral medications. For sexing for males, you'll see a large scrotum. You'll see the penile opening and anus. And then the males don't have the mammary glands like you'll see, the nipples that you'll see on a female. There's a greater distance between the papilla and anus on a male. For sexual maturity, the male is 50 days, the female 50 to 60 days. The gestation is 22 days, and they have about 6 to 12 pups. Breeding normally occurs at night. The dried semen mixes with secretions from the vagina and it forms a copulatory plug, and that plug lasts for 12 to 24 hours, and that lets us know that mating has been confirmed. For a sub-Q shot, I'm going to grab the scruff, make a tent. I'm going to approach this way, away from the head, and administer the shot. To administer oral medications on the rat, I'll hold the rat close to my chest. I'm going to stick the syringe in the side where the teeth aren't. To draw blood from the tail of the rat, we first anesthetize him because it can be painful. Got him laying on his back here. As with any animal, the mouse must be provided water. So in the cage, we'll either give a little bowl like this, or if we do use these plastic water bottles, we put them on the outside so the mouse can't chew it. Because his teeth are constantly growing, it's good to keep the incisors down. For the most part, the mouse is on a pellet diet. It's 12 to 18 grams per body weight a day, and they like eating in little small meals. And this is the pellet that we recommend that we give here when we have one for boarding, because this mouse is here for boarding. It's made by Oxbow, and it has Timothy. It's made of Timothy hay, which is good for them because it keeps the calories down, because they have a tendency to obesity. We also have another type food that has other little dried fruits and vegetable kind of things in here as well, but you've got to keep that limited once again for the obesity. And they can also occasionally have a treat. And then when handling a mouse, because they are so small and very, very quick, you have to be very careful of them not to escape. It's good to handle by carrying around near the base of the tail. We often just also grab them into a washcloth and carry them carefully to the doctor for different medical treatments. For identification, this mouse, Mr. Jingles, is going to be here for boarding. We're going to put this on the outside of his cage. It says that he is on medication. He did come with his own carrier, and he's identified here with his birth date, and that he's staying in the hospital and here for boarding. The mouse enjoys enrichment as well. They're very social and like to keep active, and so they like those spinning wheels that they can walk on. They also love to have a hidey house to hide in. They like to climb, so it's nice for them to have a wire cage with the oxygen going through where they can climb, as opposed to like a terrarium where it would be made out of the glass. It's not a good ideal for them. And they do enjoy various toys to throw around. You can even just take a toilet paper cardboard roll after it's once you've used all the toilet paper, and stuff some hay inside, because they like to forage and they can play with that. They also like the toys that you can roll around, similar to cat toys. But you got to be careful once again that they're not chewing on the plastic. So that's why it's better to do those healthier toys that are just made of the natural materials. And for their nutritional needs, we find that the pellets do give them enough nutrition. The rats can occasionally have fruits and vegetables, but for the most part we keep the mouse on a pellet type diet, and that's where it gets its needs. Once again, for nutrition, got to have the water provided as well, and also it's only about 12 to 18 grams per body weight. Some common diseases and clinical signs. We can get the endoparasites from the cestodes and the nematodes. And with the nematodes, they can travel down into the lungs and cause trouble breathing. They can also cause diarrhea, and they'll have unthriftiness. We also get the ectoparasites because lice, mites, and fleas can also infest the mouse, and he'll have different scabs all over his body. We also get malocclusion, where the teeth overgrow because their teeth are constantly growing. Another disease is the neoplasia that we see a lot, the tumors that the mice can get. And those can often be more malignant in the mouse than they can in the rats. And the clinical signs, you can feel the tumors and the lumps all around, and sometimes they don't even show signs of feeling sick. It's just the tumors keep growing, so we often remove them here a lot. If they are on the if they are external tumors, sometimes they can be removed. If they go internally, they tend to be more malignant. The clinical signs would be, it's like a soft tissue and bump that you feel. It's like an unusual swelling. We often see respiratory disease as well in mice. You'll see sneezing, snuffling. They'll have rales, trouble breathing. You can also get pasteurellosis, and the clinical signs will be very similar to respiratory disease, but they can develop abscesses as well. For the anesthesia on a mouse, we use a chamber first of isoflurane, and then we put the mask on the mouse. They have a tendency to go to sleep quickly and wake up quickly, so you need to watch carefully when they're in recovery, because they could jump up quickly while you're observing them to make sure they're okay, and could escape or injure themselves or you. We tend to use only the gases here because the injectables can be very risky in the mouse. When handling a mouse, you can grab at the base of the tail. Never grab at the middle or the tip of the tail. It can cause degloving. We recognize here that we have a mouse and a rodent. He does have some hair on his tail where a rat's tail doesn't. He's a lot smaller. He does have the bulgy eyes. He has 4 digits on his forelimbs, and he has 5 digits on his hind limbs. For handling, you can hold the mouth like this to give oral medication. And another way to restrain them is to restrain them. Another way to restrain them is to restrain them by the scruff to do your different procedures. And also for giving the subcutaneous shot. They are a lot faster than the rat, so you have to be very careful how much more quickly they can move. Also with mice, you must handle them with gloves on for the possibility of transmitting leptospira organisms. We do have a female here because there's nipples, as opposed to the male you wouldn't see the nipples. And there's a greater distance between the papilla and the anus on a male. Especially in mice with reproduction, the pheromones are very significant, because if you have a whole bunch of females housed with some males, they have a period of anestrus. And then when they are presented a male or smell that odor, they can go into estrus within 3 days. And it's more significant with mice. Give an IP injection. I'm going to have a handler because this mouse is so small. We want to make sure not to hurt him because this is a pet. I'm going to go right here in the abdomen by the leg. That's his IP injection. Okay, to do a sub-Q injection, once again, she is holding him for me. And I'm going to go right here under the skin. And that's his sub-Q shot.
Sorry, little guy.
To give oral medication, once again, I have a handler here. I'm going to insert this into his mouth.
He's trying to wiggle away.
And he's wiggling, it's little. And there we go, got it into its mouth. A rabbit, just like rodents, must have fresh water at all times. We also should provide high fiber commercial pellets in their cage. They can also have veggies and only just a small amount of fruit. But the most important thing is the grass hay. So what we do is we take a litter box, we put newspaper down on the bottom, we put the hay on top. The rabbit usually only pees in one corner, and then we'll continue to keep grazing the hay that's on the top. So we keep giving handfuls on the top as the rabbit consumes the hay. When handling a rabbit, you must remember that they're quiet, shy animals. They're not usually aggressive. So the best thing to do is to approach them by the top of the head. Never approach them from the front or have them sniff like that. They find that offensive. Often when two rabbits are fighting, they go at each other that way. So calmly at the top will get them to settle down. You also must remember that they are very fragile. Their skeletons are light compared to the rest of their body. And so any kind of kicking and twisting, they can severely injure themselves and hurt their spinal cord. So therefore, when handling them, you must always support the hind limbs and the rump. For identification, we do use the cage cards, just like the rodents and birds. But this rabbit came from the National Convention. He actually has an ear tattoo in his ear, so we will write that number down as well. And that also means that he is registered by the American Rabbit Breeders Association. So we'll put that on his paperwork and card. And that's another way of verifying that we have the correct patient. For enrichment, they need play and exercise. They're very social. They like mental stimulation. So if they don't have another rabbit that they're bonded to, you should be a friend to your rabbit and interact. They do enjoy that. They also will play with some toys. They'll either roll it out with their nose or sometimes he picks it up. He's not interested right now. But then another good toy is this is made out of willow. And because their teeth constantly grow, he can play with this toy but also chew it. And it'll help grind down his teeth. Another good toy is also, since they like to forage, you can stuff this with hay and they can try to get the hay out of here, also chewing on the paper towel roll, and they flip this around as well. Nutritional needs, once again, they must have 75 to 80% of their diet be the grass hay. It's important for their gut motility, the cecal fermentation, controls the cecal fermentation, and it's also important for their dental health because they are hyposodontic, which means their teeth continue to grow. So the constant repetitive movement of chewing the hay helps grind down their teeth. And it also provides them fiber. 25% of their diet should be these high fiber pellets, preferably made with Timothy, because the alfalfa pellets tend to have more calories. But you also still must limit the pellets to only 1/4 of a cup per 5-pound body weight, because the pellets can lead to obesity in a rabbit if they have too many. 5 to 15% of their diet should be the veggies, especially the green leafy ones. Dandelion greens are excellent. Kale, cilantro, parsley, romaine lettuce is good, but never serve iceberg lettuce. It has no calories and it tends to give them diarrhea. Some common diseases are pasteurellosis, also known as snuffles. And you'll see sneezing and rales, sneezing, and the rabbit's paws will become matted from them wiping their nose so much. You'll notice that on the forelimbs, especially. Another common rabbit disease is head tilt. You'll see one eye will be pointed down to the floor and the other eye will be pointed to the ceiling. It's usually caused by an ear infection. The rabbit will continually go in a circle and it'll lose coordination. Another disease associated with the ears is ear mites. You'll see dark crustiness inside the ears and it will have a foul odor. The rabbit will also be shaking his head a lot and scratching. Another illness is GI stasis. It's when the rabbit's intestines become static, either from a blockage or insufficient diet can be a cause as well. The rabbit will have small fecal pellets or no fecal pellets at all. The rabbit will be very lethargic and hunched over, and also a loss of appetite. Another type of non-burrowing mite is the rabbit can get fur mites. You'll find flakiness here on the back. It'll be mild or severe, and there could be patches of lost fur too. Another real common illness, once again, is the trauma from the vertebral fracture, and it's usually because of improper handling. You'll see the rabbit dragging itself with only its forelimbs. It'll be dragging the back legs. It'll be incontinent. For anesthesia, the rabbits do not need to be fasted because they're unable to vomit, and it's very important to have them eat an hour or two before and then get them eating right after anesthesia, because if they go too long without eating, once again, just like the rodents, they can develop hypoglycemia. They're easily stressed by anesthesia. Pre-anesthetic regimens that include atropine are ineffective in 30 to 40% of rabbits. They are difficult to intubate because they have a small oral cavity, so it's safer to administer isoflurane via a mask. For recovery, once again, they're very nervous animals and they fear of predators, so they must be in a very quiet environment where there's warmth, and then you need to get the gut moving as soon as possible. So as soon as they recover, they need to start eating, because once again, the risk of hypoglycemia. Also, pain management is very important because they're very sensitive to pain and can get sore easily from the procedures. We recognize here that we have a rabbit. He is not a rodent. Rabbits are lagomorphs because they have two sets of incisors. They're also larger. They're also larger than the other rodents that we've covered, the rat and the mouse. They have very long ears. They have longer hind legs than their forelimbs. They have no foot pad. The soles of their feet are covered with fur. To restrain a rabbit or move it to and from the different areas or its cage, you grab the rabbit by its scruff. Got your forearm around here. You got to support, once again, those hind limbs. And you can tuck his head in or carrying him around. The hind limbs protection is so important. Another method of restraining is to make a bunny burrito. You start with the rabbit on the towel, the center of the towel here. Fold up one end, once again over the rump, protecting those hind limbs. And you fold one section over, tuck it in, and then fold the other side. And then you have a bunny burrito. This is good for giving oral medication, syringe feeding, or eye meds. Another good way to restrain a rabbit is to lie them on their back. In between your legs here are a V-trough. And you lie them back and pet them like this. They go into a trance, and this is a good way for examining. You can examine their teeth this way. I like to also feel the abdomen. For example, if they had the GI stasis or you were worried about that, you can feel to see if the abdomen is hard or bloated. It's a good way to check the condition of the foot pads. For example, looking for the hock sores. But even though they're in this trance, they can come out of it, and they could possibly kick you. So you've got to be in control and aware, and don't get too lax thinking that they're too relaxed. To determine sex on a rabbit, if you have a slit-like opening, you apply digital pressure, and this exposes the vulva. And this is a female, because in the male, what would happen, it would be rounder in this genital area, and a penis would pop up. So this is definitely a female. Does, which are females, mature faster at only 5 months of age, where the bucks, which are the males, they're sexually mature at 6 to 7 months of age. The gestation period is 29 to 35 days. And right before the doe is going to give birth, either days before she gives birth or sometimes a few hours, she will pull fur from right in here. This is her dewlap. Also from her side and her abdomen to make a nest for her kits. Kits are what the baby rabbits are called. The litter size will be 4 to 12 kits, and the doe only nurses a few minutes a day, but the milk is so highly enriched. It is very good for the kids. Perform a sub-Q shot on a rabbit. I grab the scruff and make a tent. That's a subcutaneous shot. Phallic vein of the rabbit.
It's breathing just fine.
There you go, you got it. Okay.
Got it.
Excellent. Excellent.
For restraint of a bird, first I'm going to recognize that I do have a bird here. As opposed to a lagomorph and a rodent, some of the characteristics here, we have a beak, we have the wings, and the two webbed feet and long legs, and only 2 legs as opposed to the rodents and the lagomorphs. When restraining a bird, make sure that you are in a sealed room, that you have proper protection for your face, especially since this is a wild bird. I'm an international bird rescue, and this is a juvenile night heron. So the first thing you do when capturing a bird is you place, in this case I have a pillowcase, because with these birds they tend to want to grass, and we don't want to break their nails, so we put them on a pillowcase and cover them with the pillowcase. And so once they are covered, you get control of the head, you pin the wings, and then you would pull the bird close to your body. If you have to carry the bird to surgery, to its enclosure while staying at the clinic, this is how you would carry, like holding a football. When a person needs to examine the bird, I would hold the bird's head this way. The person examining would then pull the feet out to examine. Also, if the person needs to draw blood on one of the legs, I hold the head and pinning the wings here at the same time, hold one of the legs, they pull out the other leg and draw the blood. For giving oral medication, I would hold the wings pinned, hold the head until the person who needs to administer the medication needs to do it. Then what they do is they grab the head from me, and then they would administer the medication. This is also true when they need to do an exam and examine the head of the bird. Once again, I hold until they are ready, then they take it from me. When it comes to examining the wings, I hold the bird down. I'm holding 2 wings till they are ready. I grab one wing And it's also helpful on a smaller bird. Go ahead and grab both of the legs. Then once they pull out that wing, I reach underneath, make sure I have the other wing, and they can examine. And one of the last positions, we turn the bird over. I have once again the head covered. I'm flipping the bird over. This is for examining the keel. And we also would do this for a waterproof check because these are marine birds, and if they get oiled and we give them a bath, we lay them on the back like this and we flip through with our fingers and we make sure that they are dry underneath and waterproofed. And then lastly, one thing to mention is I'm doing the restraining with no gloves. We don't want them to have a fear of hands, and I want to be able to feel all the subtle movements. And that's the way to recognize and restrain a bird. Okay, to trim a bird's nails, we've got to be extra careful. We don't want them to bleed, and if they happen to bleed, we have ferric subsulfate and silver nitrate sticks to stop the bleeding. We're going to use a Dremel drill here to trim the nails of this bird. And it's very important to have him properly restrained. Okay, you gotta be very careful to hold one toe at a time, and while you're trimming, you don't want it to touch any of his other toes or feet or yourself get injured. Hi, bud. When you feel you have trimmed enough, you just smooth out the edges. And it's safer to use the Dremel than the clippers, because the clippers one shot and you could hit the quick. The Dremels would go nice and slow here. We also know this bird, so we know about where his quick is. And that's how you trim a bird nails. We'll go on to the next foot, but we just don't want to take up too much time. I'm here at the International Bird Rescue, and I'm going to demonstrate how to collect objective data on a bird. This is a brown pelican, and we have him covered up here to protect our handler and to protect the pelican, because we want to keep the wings from flapping and getting injured or him escaping. But one interesting fact, because a lot of them you can't sex. We try to do that, but they're sexually dimorphic, so you can't always do it with birds. With different male and female plumage you can do it. But the really special feature here with the pelican is we sex them by measuring their bill, by measuring the culmen specifically. So what we'll do here, and the handler's going to hold his big body, and also another special feature here is the handler holds the bill open. Pelicans do not have nares, so you must keep their bill open the whole time you're examining the pelican. Another special feature. So we're going to start right at the top here, and we measure down. And when we get to the edge here, we have different numbers here of male and female, and it turns out this is a male pelican. And what we're also going to assess is we're going to look at his head and eyes. And one of the things we would definitely check for is hydration. So we can pull the skin back and see if it snaps back quickly, because if it doesn't, he could be dehydrated. We also assess his attitude and behavior, and he's definitely been wrestling with us, so we would call that bar, bright, alert, and responsive. You can also have quiet, alert, and responsive, or they can be so neurological that they're not responding. We're also going to check inside his pouch, because these guys tend to have pouch lice. We also want to look at the color inside to make sure it's nice and pink. It shows that he would have good respiratory. And we also look for any kind of mucus in case he could be congested. And he looks healthy that way. And checking also all on the head and the bills, making sure the bill is smooth and there's not any injuries. We would also take the temperature of the pelican if we felt that he was really cold, because we're one of the leading oiled bird care facilities. And so if they are very, very oiled and it is cold, they can't thermoregulate properly. So as we even go and give them baths and things, we're constantly checking the temperature to see if that starts working properly. And also the classifications of dehydration are none, mild, moderate, and severe. So we classify. But this bird is well hydrated. We keep him covered. We're not checking the head, and then we pull out whatever part we need. So I'm going to start with this first wing here. And then Scott will hold the rest of the body like that and keep the other wing. And I'm checking the condition of the feathers, because the feathers are so important for them. Feathers and the wings for their flight and protection. And we're looking for any irregularities. We look for, we call these bumper wounds. We make sure that it is moving properly in case he possibly could have a fracture. And so that's one wing. I know we have to keep this kind of short, so that's just an example. We would do that with both wings. And another very important part is we feel right here on the body, because we are looking at body condition. We feel here on the keel, and we're doing two things with the keel. We're either checking for keel lesions, or we're also checking body condition. Because if we're able to feel the keel pretty easily, then it's a skinny bird. And this bird is a fatter type bird. He's got a good tissue amount around his keel, so he's doing good. And then next we go down and we will be checking the legs. We're going to be checking the hocks. We're going to be looking once again for any lesions or sores. Oh. And we're also checking, wow, on the bottom of the feet. And this pelican has very bad bumbles and sores on the bottom of the feet. I don't know if you can see, but that's something we will definitely be treating. And as it starts to heal, they keep debriding it to help it heal better. Last step was we check blood on the pelican because we want to make sure that he is healthy that way. We do this by checking the medial metatarsal vein. Oops. And if it doesn't come out in the hub, we get it directly into the tubes. And then we will take those tubes to the centrifuge, check the blood values, and then we will also extract the plasma from that to check his protein level. We also do fecal samples if we feel that there are parasites involved. Then we do the fecal samples, like we'll put them in a certain enclosure to make sure it's their poop, and we'll have that checked as well. And then lastly, after I took that bird's blood, I didn't get to properly label and put the tube in. What we do is we put the species name, his assigned patient number, and what slot it will be in the centrifuge, and it goes in here next to whatever number that is. And as I was trying to explain quickly, we spin it down and we extract the plasma as well to get a reading. And these readings are important throughout the care here at the Bird Center, because when they start with a bad blood level, once it gets up to a good level, we're able to release them. Also, we do not go and wash the oil off the bird until their blood levels are good, because especially when a bird gets a bath and gets all that oil scrubbed off of them, that is a really high stressful moment, and so they have to be at the proper health with their blood.